Good morning, good morning, good morning, good morning, good morning.
Mm.
Thank God it's Friday. Oh my,
Yes.
this has to be the longest week of my life, right?
Yeah.
But we made it to Friday, and when we make it to Friday, you know what that means. That means another episode of the CareSouth Carolina Community Live podcast.
Yeah. That's what it is. Yeah.
Hottest
Yeah.
podcast on Facebook at this moment. So.
That's right.
And ladies and gentlemen, my name again is Mark Calhoun. I'm the Director of Social and Community Services for Care South Carolina with my partner in crime, as always.
I'm Daniel Myers. I'm the MATSUD Program Director for Care South Carolina. And Marek, I'm so glad it's Friday. I'm so glad it's Friday.
Oh, man.
Only one thing missing. We
What's
ain't
me?
got paid this Friday.
That make it better on the pay Friday, don't it?
It do. All right. So I think we lost Marek for a minute. And so today we got with us Dr. Cabrera, who's a provider over at our Dillon office. Brand new to the team. Not spanking brand new because she's been here for a little while, but she's still got new on her. She's still got the plastic on. We haven't taken the plastic all the way off yet. But she's doing great things over there in Dillon. And Marek is back. Marek, you want to finish the introduction?
Yeah, you were doing such a great job. Yeah, like you said, we have Dr. Cabrera. She's like you said, one of the newest, but not new anymore. You know, like you said, we done took the plastic off her, and she's rolling, ready to go over in Dillon, doing good things, doing great things, and we're so excited to have her here today. I'm going to also turn the mic over to her and let her kind of introduce herself. Tell us a little bit about yourself. Where you from? Just look. I'm sit back. It's on you.
Well, hi everybody. It's so nice being here today and just having a chat with you guys and being able to talk to all of the community here within Care South. So as the guys said, I'm the new provider here at the office in Dillon. Um, Originally, I come from the Dominican Republic, so all of my family's there. Beautiful island. Um, I would say definitely a lot of great things there. Most of you probably know it just because of the beautiful beaches, Punta Cana, all those places. So that's basically where where I'm from. And a lot of people just say, "Why did you move? Why did you move?" But I'm definitely looking for other opportunities when it comes to your professional career and all that. Despite that, I have been here for a few years um, since I did my residency in medicine back in Texas. So I spent over 3 years in San Antonio just finishing my internal medicine residency. So, and after I was done with that, I definitely wanted to pursue my career in primary care, and that's why I ended here in Dillon and working for Care South, just because of the whole structure and how the vision that Care South has when it comes to primary care. I would say it's definitely been a passion of mine, working with underserved communities even before I moved here. My first job was actually working for a nonprofit, fresh out of medical school. And the nonprofit that I worked as was, I was basically a provider, and all I saw was diabetic patients. And I find that that really helped me on top of my residency just because of all of the chronic diseases related to diabetes that unfortunately I do have to see here and done. And throughout my residency, sort of the area of San Antonio that I was, also we worked with underserved in an underserved area. In that case, was mainly Hispanic patients. In that case, speaking Spanish also really helped me try to develop those relationships with patients. And now I'm here. Basically very happy to be here and be part of CareSouth. I definitely think that what we do really makes a difference. And it's something that basically providing good quality health and healthcare access, especially primary care. It's so important. It's so important, not only to prevent patients from developing the consequences of all those chronic diseases and having the ER just working as a revolving door for all of these patients. We sort of try to avoid that and prevent things from happening. And in that way, that's why I like primary care so much, just because we're not only able to provide health, but also quality of life. Because if you're able to prevent these things from happening in the first place, you're not only going to improve the quality of their health and also their lives and also their quality of life, which is in the end what we want, I would say. So really, really a great opportunity to do that in the position I'm in.
Wow. So yeah, so we go back up all the way to the beginning, then we're gonna come back up because
Mhm.
we are really blessed to have you here at CareSouth. You bring a wealth of experience and a wealth of resources that we really need here.
Mhm.
And I met you, I think your first or second day there,
Mhm.
and I loved your passion then because you was ready to get to work, boots to the ground, and start doing what you can do for people in our community. But I want to back up for a minute because I'm still stuck on you leaving the Dominican Republic and
DR.
coming to Dillon County, and then also San Antonio. I was stationed in San Antonio. I was in the Air Force, so
Mhm.
I was stationed in San Antonio, Lackland Air
Um,
Force Base, which is a Wilford Hall Medical Center, which is the biggest hospital probably in the United States.
Mhm.
Um, when I was there, it had over 12 miles of hallway, and I've heard since that time they've increased in size. But um, just coming from that type of area and coming from Dominican Republic, what do you see that's different here, or that's similar here than the places that you've been and that you serve as a provider? What's the difference?
Well, I would say if we can start things that are different, obviously. Um, Living in the Dominican Republic, I would say, and growing up there and moving to the States, um, it's definitely a bit different. Not only when it comes to culture, food, everything. A lot of things are different. Mindset, your mentality. Um, and I would say that's good because it opens up your mind to a set of things that without you having that experience, you wouldn't have been exposed to. Hard thing is leaving your family behind, which is something that's a common thread between everyone that basically it's an immigrant, someone that leaves their home country. You're leaving your family. You're leaving what's familiar to you in order to basically better yourself and at the same time better or improve the quality of life of your family. So those are the things that are hard and the things that are different. It's that when I go to San Antonio, I would say things that were similar would be in San Antonio, there's a very, very large Hispanic presence. So I would say in that way, I was still connected to a little bit of my culture and my food and all of that, but it was different. I mean,
mhm.
living in the States and also the healthcare system. It's very, very different. So I would say in that way, they were similar because of the cultural similarities back to my home country, but it was definitely there's definitely an adaptation period, especially when you're starting as an intern in residency. I would say it was one of the most challenging experiences of my life. And then after you're done with residency, you move to Dillon, and I moved to Dillon, and now I am basically an attending because you have to understand that during residency, um, even though you are a doctor and you're fully qualified, still you have attendings that sort of supervise everything that you do. Now you're basically responsible, so you don't have anyone looking over your shoulder and making sure that you're doing things right. So at this time, you basically have to be extra careful and very confident in what you're doing. And still, I would say it's a learning process for especially in medicine, every day you have to be learning new things and challenge yourself. Um, because when you start thinking that you know it all, you know that's when things are going wrong. This,
Mm.
and that's why I like to see clinics and healthcare settings as a team. Just because the provider doesn't mean that just one person can make everything happen for the patient. It's basic medicine, especially primary care, from now on, and it's been happening for a few years. It's all about integrating care. We need our patients advocate. We need our pharmacists. We need our nurses. We need everyone to work as a team in order to make this happen. So I would say those, when it comes to Dillon and San Antonio, that's very similar. But if you compare that mentality to what happens in undeveloped countries or underdeveloped countries, it's even more difficult. The system is very fragmented. And I would say a lot of the responsibility when it comes to seeking health or healthcare falls on the patient.
Mhm.
Um, So if you don't, there's definitely not enough access to resources to the ones that we have here. For example, in CareSouth, we have patient assistance programs, we have the visits, we help with medications. In San Antonio, we did have something similar to provide aid with patients, but we don't have any of those things in the Dominican Republic. So a lot of the responsibility falls back on the patients and the patient's families or uninsured to basically cover for those things.
Yeah, and that's one of the things that really drew me to CareSouth is that there's so many programs to help. So no, they really remove all the barriers to healthcare, and it kind of places the patient on a pedestal, and we get it's like we're tailoring to their needs. If they need something at the bottom, then we help them from the bottom. By the time they leave CareSouth, they're fully dressed, and they all their needs are met. Under one roof. In most places, we have the pharmacy, the lab, and all those services under one roof. Dillon doesn't have the pharmacy yet, but we know that I passed by this morning, the new building site. I know you'd be glad to get a little more room, a little more leg room over there.
Yeah.
But they begin to they've already started putting up walls, so it's just a matter of time before the Dillon site move into the new building. And I know for a fact you guys need space over there. And we know that you're doing a wonderful job in spite of the size of the place. But it's not the size of the place; it's the heart of the people that's in there. And you guys have a big heart, so you make the place look a lot bigger because of the service that you render over there. What has been some of the challenges here in our community that you see? Some of the things that made you say, "Oh, I didn't know all this was going on over here." What really made you look at Dillon and say, "Okay, well, I can really be of help here"?
Well, and definitely have to say that at the Dillon office, we have a fantastic team. I would say what makes the office be such a or be a good place to work, it's basically the people that work there. And that has to be or it's always the biggest asset when you're talking about running a clinic. It all has to do with um, the patient, the person that treats the patient. And I would say definitely, I was very impressed since I got there how the people treat the patients, or all of the employees treat the patients, and also treat me when I first came in. But again, it everything always has a set of challenges. Um, and I would say that one of the things that I did notice was definitely there is a bit of a gap when it comes, and I would say this happens everywhere, not only here in Dillon, but health literacy and medication compliance, they go just hand in hand.
Yes.
So I would say that that's it's definitely something, an area for improvement. And just spending some time talking to a patient about why is it that you need to take this medication? Um, what are the consequences of not taking them?
Mhm.
Those areas definitely we need to improve there, because I believe that in the future will lead to more medication compliance with visits and all of that. And for patients not to wait until they feel really sick to come in and see us, but rather come periodically, so we can basically be ahead of the curve and address issues before they become really, really big issues. So I would say that's one of the biggest challenges I face in primary care, and also
Okay.
area for improvement.
And I do agree with you. It's because some of our patients, they come in and the providers talk to them, and it goes in one ear, not the other. They never take time to ask questions, and so getting them more engaged with their healthcare is going to be very, very important. Also, more uh, staff to patient participation as far as patient education is going to be very important. Um, and also just letting them know to take pride in their own health, take responsibility for their own health. Um, and I always say this on this podcast, but one of the slogans that I got from Project Lazarus, which is a substance use project over in Wilmington, North Carolina, they said that every community is responsible for its own health. So it's up to the communities that we serve to make sure that our patients and our citizens are educated concerning their health, the medications, and their nutrition, right? And health includes your dental health, your mental health, and your physical health. And so we can get all three of those things on the same track. Then we can change some of the outcomes that we have now in our rural areas. So
Yeah, and that goes with the integrative model that it's the ideal one for healthcare, what's going to go now and the future. But it also puts more pressure in everyone that's part of the healthcare team to make sure that we're addressing these issues. Because remember now, we're seeing a patient not only as a disease, not only as an illness. Someone comes in with hypertension. Okay, it's not only the hypertension. We need to address also what's going on at home. Do you have access to medications? Do you have access to things that are healthy to eat at home? So that also puts more pressure on us, not only the providers, but also everyone on the team to figure out what's the best way to act. Um, but I definitely agree that giving patients more responsibility or accountability when it comes to their health, it's important. But it also puts more pressure on us as providers and the healthcare team as a whole to address those issues.
well, a big part of that team that help assist that is Mark's crew. And Marek, I guess he can give. I don't know if he ever gave you. I don't know if you ever really got a rundown on what his team really does. I know that you got a snapshot, but for the people that's listening, he can kind of fill them in a little bit too and let them know exactly what that department, community health, really entails when it comes to assisting you with what you do as a provider. Marek?
Yeah, absolutely. And I'm really glad she mentioned being able to have health.
We lost her.
We lost her, yeah. But I'm glad she mentioned having healthy food options and other things going on in the community and that patient's life that may become a barrier. And that's what we do in community health. We address those barriers that may cause an issue or cause a barrier in an individual's health that really doesn't have anything to do with what happens in the there she go. Welcome back. But yeah, those barriers that may affect the individual's health that may not have anything to do with what happens in the exam room with the provider. It's those social things that create a barrier that could also have an effect on the individual's life. Like she mentioned, not having healthy food choices, not having food period in your home, and not being able to afford rent, being able to afford transportation to your doctor's appointments. So those things are very important, and that's what my staff does. That's what we do in community health. We try to work with the patient to knock down those barriers, address what we call social determinants of health, and address those barriers to be able to assist them in the better connecting what happens in the exam room and to improve what happens socially so the two can meet and improve an individual's health. So
Yeah. And so, Dr. Cabrera, those that staff is there at your disposal.
Oh yeah.
And, and the resource to assist the patient in any way they can. And and I'm pretty sure that they'd be more than happy to do anything that you want to do because Marette got a pretty jam up team. Some people say now, this is what they say. They say that Marette is one of the best supervisors in CareSouth.
Oh,
But
yeah.
what they whisper after they make that statement is next to Daniel, right?
No, and the staff that we have at the Dillon office, I mean, it's great. Our patients advocate are fantastic, and it's so great just having them in our office all the time to help with all these things that we were talking about. So they're great.
Good. Well, once again, like I said, you have added so much value to our community by coming, and and by you being bilingual, that really help us close some of those gaps that we need to close with other people in our community. So that's a hey, that's why you're my hero, right? Because there are some areas that we can't reach because we just don't have the ability to. But now with you being there, having that resource, that's an additional weapon with us, getting, lowering our numbers for diabetes, lowering our numbers for hypertension, for, any other chronic illnesses or infectious diseases. So we're glad that we have you there to help us with that. And just a little plug, I know soon that you'll be finishing some of your training with MAT. So she'll be helping with that aspect as well. So yeah, man. Yeah. Yeah. I ain't never give her opportunity to get her feet wet, and I jumped over there and jumped on that right away. You know what I'm saying? Because we need that. We need that help, increase access to care.
Definitely. Yeah, looking forward to all of that. And again, it's also a learning opportunity for me and a growth opportunity for me just to be part of the team and have this experience. And also getting to know my style as a new provider and attending, working in internal medicine. Definitely, it's a great opportunity.
Wonderful.
Yeah.
Wonderful.
And speaking, we do a lot of work with the agricultural farm worker community, which a large majority, probably 99% are of Hispanic descent. And so I was excited. I was like, she what? Huh? Okay. It was like, well, hold. Let her get her feet under her first before you hit her. So she know. I told her the other day, I'm coming. I'm coming. I'm coming because I definitely got a lot of providers that are willing to and have worked with that program that we have set up, and I definitely would love the opportunity, as we talked the other day, to have you into that fold and be able to work with you with that program. So
that would be fantastic as well. Yeah, looking forward to that.
So our time is
coming. Okay. So, Marek, so I know about this time we usually ask them the most important question out there that we we don't really tell them what it is, but it's a very important question that we ask them that makes it kind of makes this podcast what it is. So look, I mean, she here now, so we might well go ahead and hit her with it, right?
Yeah, I'm gonna hit her with it. Well, let me say something first.
Okay.
So 2 words when I heard she was from the DR. All I thought is road trip. Yeah, road trip. Like, yeah, road trip, right?
Yeah,
road trip. Like, I want to go.
Yeah, me too. Me too. I didn't want to say that, man. I'm glad you broke the ice.
Yeah, I want to go, but
yeah,
we'll wait. We'll wait.
Yeah,
maybe we could talk in the and making that a cultural experience and I get
yeah.
Wouldn't it?
No, we can ask. I mean, it won't hurt to ask. But Marek, I want to go too. I want to go. Yeah.
Yeah, you're welcome. You're welcome to go. I know my mom will definitely make some room for you.
Yeah.
We Dominicans, we're very welcoming. We're very, very welcoming.
Oh wow.
Well, that I will say that the Dominican Republic is on my bucket list. Everything with COVID going on, you want an opportunity, kind of stop that bucket list a little bit last year, but I'm gearing up. Hopefully next year we'll be able to go. Even though I do have a cruise planned for December. Yeah. Hopefully we can still, being fully vaccinated, hopefully we can still go on our cruise. But that is definitely something that we're looking at planning for next year to be able to go to DR and enjoy ourselves. So I'm gonna be looking to you for some tips and some good places to eat, non-tourist places to eat. You know what I'm saying? They know where to go. They know where to go
Definitely.
for real food, right?
Yeah, there's great food. And I mean, the biggest asset, it's all the beaches that it has. It's just beautiful all over. I would say, and it's not only about beaches. It's also about, I would say, the people that you meet there, and you'll get to see how we are. The food is great, not only because I come from there, but food is great. I'm not saying that just because, but definitely, I would say a different vibe. Also, um, the mindset, how you feel when you're there.
Yeah.
Yeah, it's definitely a great place to go for your next vacation.
Good.
Good. Good. Now that you're here and you're getting settled in, you've gotten settled in or still getting settled in, what does Dr. Cabrera like to do on her days off when she's not at CareSouth? Like for instance, today, you're technically off today, but you're here with us, and we definitely appreciate it. So,
Yeah.
what you like to do on your days off when you're not at CareSouth?
I would say before I actually moved to Dillon, I was spending a lot of time in Real Beach. So, and I really liked it just because, again, I come from an island, just being near the beach was really nice. So, so I was going to the beach quite frequently before. Now, since I moved, just because always there's something to do or something to set up or some furniture to set up, I'm mostly doing that. So I've become an expert when it comes to DIY furniture. Um, so I've been doing that. I love cooking. So
Okay.
more than I know that sometimes in Dillon it's a little bit limited like when it comes to restaurant. It's easy. It would be easy to go and get fast food and things, but I actually rather just cook things myself, so that way I can sort of control a little bit of what goes in there, and also try to follow a little bit of the advice that I give my patients. Because if I'm telling my patients, okay, try to eat low in sodium, low in sugars, I should be doing the same thing too. I feel. So, so yeah, that's sort of what I do. Just get ready for the week, have my food ready, setting up some furniture together, spending some time with my family over the phone, just because for the week we're working hard, I'm working hard, so it's sort of a little bit difficult to catch up. And I have a big family, so there's always something going on.
Okay.
Yeah, so this is sort of the perfect time to catch up with them and see how things are going back.
Oh, well, that's wonderful. And it's funny that you say you like to cook because me and Daniel we like to eat. So
We love it.
Don't we all?
so
Yes.
so when y'all have those potlucks and stuff at the office, those are good times when I like to make site visits, and visit.
Oh yeah.
You know, I have like a pipeline. They tell me, we cooking today. We cooking today. Okay. Love
Just
be there.
having to show up. Yeah, just having to show up, just in time. Oh, y'all eating today. Oh wow. I didn't even know. As I pull my fork and spoon out my back pocket, right?
Right, exactly. How fork and spoon will travel.
Yes.
Well, that's wonderful. That's wonderful. And definitely, we really appreciate not only you joining us on the show today, but also having you at Care South Carolina and having you serving the patients in the Dillon area. Thank you for all that you do and continue to work and serve the patients of Dillon County. And if you need anything from, and I believe I can speak for Daniel and he can speak for me. If you need anything from either one of us while you're here, whether it's work or personal, let us know.
That's right.
Yeah, no problem. Thank you so much, and I'm definitely blessed to be part of the team, and also have all the coworkers at the Dillon office that I have. They've all been fantastic, and again, as I said, that's the biggest asset that we have. It's the people that work at our office.
Absolutely. Absolutely. Well, ladies and gentlemen, again, we welcome Dr. Cabrera to Care South Carolina and the Dillon office. Thank you for sharing your day with us. Thank you for coming on with us. And everyone, thank you for tuning in today. If you want to learn and book an appointment with Dr. Cabrera, you can contact us at the Dillon office or you can contact us via our website at www.caresouth-carolina.com, www.caresouth-carolina.com, or you can reach out to us on our 1-800 number or 866-498-0399 for more information in reference to Care South Carolina and how to book an appointment for Dr. Cabrera. And also, we are a private partner of the South Carolina SNAP program, Supplemental Nutrition Assistance Program. So you need information and assistance with signing up for SNAP, please let us know and we can assist you. All right. So
Thank you for thank you guys.
Yes.
all right. And we'll see you again next Friday for another edition of the Care South Carolina Community Live podcast.
Stay on, Dr. Cabrera. Stay on just for a minute.
Okay.
Yes. All right. We're gone and have a wonderful weekend, everyone.